Hello, doctor. I am glad that we have crossed paths today. Do you have a minute to talk?
Well, I guess. What is on your mind?
Well, I am a bit confused regarding my diet. What is the best diet for me in order to maximize my health?
Sir, I will need a little more information from you in order to answer that question. A good diet for one person may not be a good one for another person.
Okay, that is fair. What would you like to know about me?
Gotch, for starters, please tell me about your past medical history. What health issues do you have?
For starters, I have peptic ulcer disease and gastritis.
Okay, do you drink alcohol or take non-steroidal medications like ibuprofen or aspirin?
Is there water in the sea? I drink alcohol like fish drinks water. I like to have a few drinks after a day in the office, if you know what I mean. I also take ibuprofen daily for my aching knees. Why, is that any of your business?
Young man, individuals with peptic ulcer disease and gastritis should refrain from drinking alcohol since it irritates the lining of the digestive tract. Non-steroidal medications should also be avoided because they can also lead to mucosal damage. You may also feel less discomfort if you avoid extremely spicy foods. Do you have another issue?
Absolutely. I think I had a gastrectomy for the ulcerations in my stomach. I swear that I have to go to the bathroom almost constantly after eating. Got to go right now. Diarrhea. If you know what I mean. I sometimes struggle to find a bathroom in time. Do you have any suggestions to help with this?
I would suggest a commode.
What?
A portable toilet is known as a commode. You could use a commode, but if that is not a desirable choice, I would suggest that you follow a few dietary changes. First of all, you need to limit your carbohydrates with meals. Additionally, do not drink fluids for 30 minutes before or 30 minutes after meals. You also need to rest after meals. If you do these things, you should have less diarrhea.
Thanks. I also forgot to mention that I also have issues with pancreatitis. Any suggestions to deal with that issue?
This is another reason to stop drinking. Eliminating alcohol from your diet should help. If you have a sudden onset of abdominal and back pain that you think is pancreatitis, stop eating and go to the emergency department. Refraining from eating often helps acute pancreatic attacks. If this is a chronic problem, you can help yourself by limiting fats in your diet. The fats that you eat cause the pancreas to secrete more digestive enzymes, which makes the problem worse.
So you are saying that I should not drink alcohol and I should eat less fat to prevent recurrences of pancreatitis?
Yes, those are two suggestions that are beneficial for a lot of people. You can't possibly have more health issues, can you?
Of course I do. Apparently my alcohol use has also led to liver cirrhosis. What changes should I make in my diet because of my cirrhosis?
Interesting. You do not appear to be showing signs of cirrhosis.
Well, doctor, I am using makeup on my body. My skin would be the color of those cabinets and my belly looks like I am very pregnant. Fortunately for me, I found a very effective corset.
Once again, stop drinking alcohol, sir. You are really doing a great job hiding your ascites, I mean your big belly. Changing your diet will be more effective. You will need to limit sodium in your foods. Almost anything that is canned should be eliminated from your diet. Canned soups, canned meats, canned vegetables, and prepackaged meals. You need to limit your sodium to less than 2,000 milligrams per day to limit your ascites.
So I just need to limit my sodium for my cirrhosis.
Sodium restrictions would be the biggest dietary change if you have ascites. If you are retaining fluids, then you may also need to limit fluids. You will also require extra calories. Many individuals with bad livers need up to 3,500 calories per day.
So I may also need to limit the amount of fluids I drink.
Yes. Additionally, if you would get encephalopathy or confusion from your body's inability to get rid of protein waste, then you would also have to restrict the proteins that you eat as well. But we do not routinely do this because people with liver failure often suffer from malnutrition. If you had encephalopathy, you would also be started on a medication called lactulose. That would make your diarrhea worse. Anything else? Obviously, you are a model of health. Please realize that I am being sarcastic.
Well, actually, I also suffer from inflammatory bowel disease. How should I deal with it?
If you suffer from an acute attack from Crohn's disease, ulcerative colitis or diverticulitis, you need to go to the hospital. They will not give you anything to eat during the acute episodes in order to rest your digestive tract. When you begin foods, you will start with liquids and then advance your diet to a low-residue diet. It is the same diet that individuals follow after a bowel resection.
Bummer. How about if I have a bowel resection for these issues? What will they feed me then?
Initially, nothing. They will wait until there are signs that your bowel is waking up, like bowel sounds or flatus, before they feed you.
I am not sure what you mean by flatus, doctor.
They will wait until you fart, toot, cut the cheese, expel gas, make a stink.
Got it, doctor.
Good. Once things start to resolve, they will give you liquids at first and then advance you to a low-residue diet. This diet is appropriate for diverticulitis, Crohn's disease, ulcerative colitis, and after a bowel resection. You can do this by peeling and cooking your fruits and vegetables, avoiding whole grains, nuts and seeds, and choosing white bread instead of wheat bread.
How about if I have diverticulosis?
If you have diverticulosis, that means your bowel is not inflamed. Then you should eat higher fiber foods at that time. Has a doctor really diagnosed you with all of these health issues?
Well, no. I did a Google search for abdominal discomfort and all of these health conditions came up, so I must have all of these issues. I believe that while I was passed out, aliens performed a gastrectomy on me.
I do not believe that. Has a doctor ever diagnosed you with anything?
Yes, my doctor has diagnosed me as being a hypochondriac.
Now that, sir, I believe.